because there is just this massive gap between, I'm so sorry you have lung cancer, and okay, here's what we're going to do about it. I mean, that sometimes is days or weeks or even a month or 2 months sometimes to get all of the information that you need to move into treatment. So how would someone who is just been diagnosed with lung cancer get connected with a patient navigator, or in your case, a nurse navigator, and talk about what you help them do?
Yeah. So with patient navigators, I know that you can find them in usually the public health system or a community. And how I've been connected to them is the patient navigators will usually reach out to us and tell us about a patient that needs a connection to us. So I would, that's how I coordinate with a patient navigator. Luckily, our facility has the nurse navigator program. So this has been new for me. We didn't have one until this last year. So for me, I've developed this kind of myself in a sense of I've worked in the clinic for my clinic for years, and I knew that there was always this need for a navigator in our clinic. And some of the main reasons why is because of exactly what you said with the gap is there was nobody really to talk to a patient until they came in for that provider visit. So my main role is to, as soon as I get a referral, is to make that connection with the patient right away of, let me introduce what I do, who I am, what our team does. And then the big thing, especially for new patients, is to kind of explain what things need to be done, what things need to be worked up, why maybe it is a process of, and we can go into this later, about the staging workup for a patient and why it takes maybe a few weeks. And it's really just to help anxiety, for patients, once they hear they have that diagnosis, all these things are going through their head of, what stage and what treatment and all that kind of stuff. And there's different treatments for different stages. So my main thing is to connect with those patients to kind of give them the information, educate them a little bit more of making a plan, and then, go through the process of getting them set up with us for a new patient visit, what that's going to look like, maybe some things we can get in process before they come if they're comfortable. So that's how they could get connected. In our facility, it's pretty easy. They just have to call and make an appointment, and that I'm the navigator that calls them. Not every facility has a navigator. So I think that I'm a big advocate for the navigators because I've been in a facility that doesn't have one. And then I've noticed personally what a big difference a navigator can mean to patients.
What a tremendous difference. I'm thinking of a conversation that I had with Dr. David Carbone, who's with the Ohio State University, but he is a lung cancer expert, thoracic oncologist. And he talks about that sense of this psychological emergency when you've been told that you have lung cancer, and it feels like, now I need to do something this minute. I need to start treatment tomorrow.
Mm-hmm.
And, he and I know Dr. Camage in your facility talk about, let's get all of the information and all of the details. And there's so much that goes into it that someone who's just coming into lung cancer for the first time wouldn't know. There's no reason that they would know that. So, that's part of your work, but you also provide referrals on some real nuts and bolts stuff like dietitian and financial resources, maybe social work, down to things like parking.
Mm-hmm.
My goodness. I mean, you drive out to this beautiful facility at CU Anschutz, and it's just like, I don't even know where to go.
Yeah,
So talk about all of those elements of service that you work on and help people navigate.
Mm-hmm. Yeah, the just the parking alone here, or just to physically, where is the building and what floor, I always knew that I needed to incorporate that with what I'm doing with navigating, because of course I got those phone calls in the clinic, but when I start doing it, that little piece is a big anxiety for patients. I come here every day, and it's not I see the parking, it's no big deal, but like as a new patient, like just that little thing makes people go, oh, good, thank you for calling. So, what I've done is for patients is I've developed a map of the campus where I send it to them so they can physically see what the campus looks like. You really only have to come to one building. I specifically have directions of what elevator, how to physically get off the elevator and take a left, and that's our lobby. Like that just already decreases that first time visit. So something very simple, but means a big thing to patients. And a lot of it is like that first, especially that first phone call is, I get quite a bit of information and patients just kind of lead into the next thing. The big thing is, a lot of people have financial hardships, and how am I going to pay for treatment, or, how do I physically get to the clinic? I don't have a car. So those things are great to have a bit at the beginning. Again, those are a lot of anxiety for patients. So I will connect them with our social worker or financial team right away. They make phone calls and start talking to patients about that. Lodging, if they're from out of state, we have some grants at our facility that is the social worker can help with. So that is a big piece. Dietitians, if I can kind of, especially if they're internal, I can tell that they've lost weight or eating has been an issue. So I talk to them about like, let's get you looped into those. Some of those people can meet with patients that first day if they're not too overwhelmed by that new patient visit, or at least a phone call that they're happy to get. So some of those referrals I can get in place at the beginning, or after I usually meet the patients when they're here at that first visit, and we can talk about that when I kind of close that loop on that of making those referrals, and knowing that you might not need this now, but this is what we have. And as time goes on, when we get a treatment plan and you're starting to be more established in our clinic, those are always available. So
I'm just thinking of, you mentioned that idea of just decreasing anxiety, and it kind of decreases my anxiety just thinking about it, because you're right. I mean, just from, the moment of like, I don't even know where to park, and I'm going to be late to this, and then I got to navigate this massive building, and all of these things. It's so nice to hear you talking about that. We know that there are so many appointments, so many different people to see, so many different tests, so many different places that information needs to go throughout your facility. You mentioned when we were sort of getting prepared for this, how you do things, and this is another one of these things that seems so simple, but what a major anxiety alleviator to know that you're trying to coordinate appointments on the same day and make sure that if somebody's coming in, they're going to get the blood draw, and they're going to get this, and they're going to get that, and it's all on the same day and same thing, and everybody can take care of it. So how do you what kind of reaction do you get from patients when you help them do that kind of real nuts and bolts and scheduling kind of work?
Yeah, when I first started this, I didn't know how patients would react, because a lot of it is they don't know what to expect. They don't know what goes into an appointment. I didn't know if people would want to do this on like some of this testing ahead of time, coming from just a nurse. But I have been, almost everybody I've talked to have wanted to get things in place before seeing the doctor.